what is heart attack? If there is a sudden blockage in any of the blood vessels which supply the heart, and if that leads to complete cessation of blood supply to one area of the heart, that is what is called heart attack.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack.
But common heart attack signs include severe, persistent, or recurring chest pain or tightness, pain that radiates outward, feeling short of breath, dizzy, faint, cold and clammy, rapid heartbeat. Symptoms more common in women are often extreme, unexplained fatigue, nausea, or heartburn. Any unexplained chest pain should be checked out by a medical professional.
A heart attack, or the medical term for it, is myocardial infarction. It literally means that a part of the heart has actually died. So atherosclerosis is the hardening of the arteries we often hear. And what happens is sludge builds up on the pipes, and over time it can actually get to a point where it really restricts blood flow. That creates angina. But a heart attack is actually a sudden rupture of a plaque, some sludgy areas in the arteries, and suddenly blocks the artery altogether. And that causes incredible pain to the heart, and if it's left long enough, meaning we don't put in a stent or bypass or try to get rid of that clot in some way, it can lead to death.
Test is good for anybody over 50 and anybody that has risk factors. Smokers, diabetics, people who have chronic hypertension, family history of coronary artery disease, any prior coronary artery event.
Here's what it's like to get the non-invasive exam.
And then lay on your back and put your head on the pillow. You'll lay down on the table goes up.
2 electrodes are attached to your chest.
You're going to bring your arms up over your head.
Then the study starts. The entire exam typically lasts 3 to 5 minutes. Calcifications show up on your scan, and the amount of plaque is compared to other patients your age to determine your score.
It's a general screening test, and a 0 or a low score, say less than 100, would put you in a low risk category.
With answers from the test, you could prolong your life by making changes to your diet or activity level. Your doctor may also recommend statins.
You can self-refer. We see a lot of patients that come in and do that. I just encourage people to take control of their health, and that includes maintenance and preventive measures, including this CT scan.
Yesterday in the coronary intensive care unit, I saw 2 patients who had had a heart attack. And in both cases, the patients, one a man and the other a woman, had stayed at home for 4 to 6 hours before coming to the hospital. People should know that in the modern era, we can actually stop a heart attack by taking patients to the heart catheterization laboratory and opening up the blocked coronary. When patients wait 4 to 6 hours, they don't get the benefit of that modern treatment. It works particularly well if we can get the artery open within 90 minutes. So if you have chest pain, don't delay, get to the hospital right away.
There are numerous things that result in a patient needing to have heart surgery today, and that would include a problem with their coronary arteries, blockages of their coronary arteries. Then you have a huge category that's actually growing now where the valves either leak or they're too tight. The third category, although less common but still exists, in which patients have had congenital heart problems that they were born with, and now they've grown into adulthood, either having had them diagnosed late in adulthood or knowing that it was there but now needing to have something done about it. A fourth category would be electrical problems with the heart, in which there would be some conductivity problem or rapid heartbeat problem that would result in needing to have specialized studies done and then possible interventions. Traditionally, everybody knows about open heart surgery through what we call a sternotomy, where people, quote, have their chest cracked, which is the typical terminology for that, but basically it's dividing the breastbone, going through the middle of the sternum, to get access to the heart. And this has served physicians and patients very well for 30, 40 years. We have become more and more comfortable with doing the same types of procedures through smaller incisions. So we have begun a fairly comprehensive program where every patient that comes to our center is looked at initially for a minimally invasive approach, a small incision approach or a robotic approach, one of the two. And if they are candidates for that, then that's how we do them. If we can't do it that way, then of course we offer them and provide them the traditional approach. But every patient first is considered for a small incision and less invasive surgery. I do think it's important today, as we go forward, that patients understand that as we have emerging technologies that are rapidly coming at us, it's important to choose a hospital that has a team that is looking at that. The team is highly specialized and super specialized in the area of coronary bypass surgery or minimally invasive valve surgery. All those are teams of experts that share their particular area of expertise. I bring something to the table as a surgeon, the cardiologist brings something to the table as a surgeon, and then at the end of the day, we have the best plan for the patient with the current and emerging technologies. Probably only about 15 to 20% of centers in the country are routinely doing successful minimally invasive valve surgery, either aortic or mitral or closing holes in the heart or doing electrical work. We understand now that high volumes equate very much to high quality. The centers that are doing higher volumes and the centers that are developing this team approach and a comprehensive commitment to minimally invasive surgery and robotic surgery, utilizing those types of techniques, are the ones that are getting the best outcomes.
Heart attack is the complete blockage of a coronary artery, which deprives a section of the heart muscle of its blood supply and therefore its oxygen supply. The onset of pain is usually sudden and may occur at rest. However, the pain is not relieved by rest.
Just got these chest pains.
Well, when did that start? Central chest pain or discomfort, which lasts for more than 10 minutes, is characteristic of a heart attack. The pain may radiate into the arm, neck or jaw. The casualty may be short of breath, have pale, cold and clammy skin, and complain of nausea, or they may vomit. The conscious casualty should rest in a comfortable position, generally sitting upright. Okay, this doesn't seem to be getting any better, is it?
Getting worse.
Yeah.
Getting worse.
Okay, well, look, we've waited long enough. I think I'll go and call the ambulance, okay? Reassure them as they will be anxious and afraid.
Hi, I'm Kathleen. I'm a physical therapist here at Sharp Steel downtown, and today I'm going to show you 3 exercises that you can do anywhere to improve your heart health. A lunge is a dynamic, full-body exercise that can be done anywhere. It will strengthen your legs, core muscles, and increase your heart rate. Push-ups are a challenging exercise for the upper body and core. Push-ups are easy to do on a raised surface such as a table or countertop. For added challenge, try them on the floor. Even a few minutes of walking is enough to provide cardiovascular benefit. You can walk around your neighborhood, take a lap around your building at work, or even go for a longer walk in the park.
Broccoli, oranges, spinach, and then there's other things going with spinach. Blueberries, those are really good and they freeze very well. Pumpkin, not just for Halloween. Turkey, not just for Thanksgiving. Soy, yogurt, whole grains. Now, You know, people are getting on the bandwagon, they're saying whole grains. It truly needs to be whole grains. It can't be whole grains to start with and then processed to oblivion. Walnuts, very, very good. And there's all the sidekicks for walnuts, including the peanuts and macadamia nuts that I have. Tea. So those that are coffee drinkers might want to consider having a cup of tea every once in a while. Wild salmon, not the farm's kind, the wild salmon. And beans, not just the kind that are musical, okay? And tomatoes. It's not just about avoiding disease though, it's about feeling good. It's not just the last fourth to a third of your life that's affected, it's every single day. If you can switch over to these superfoods, you will feel a whole lot better.